Hi, thanks for joining. I'd like to start off with a couple of questions for you to think about. First is, have you ever tried to quantify the number of resources and how much time and effort goes into administering and managing the medical licenses at your organization? And second, have you become numb to how insanely complex the process has become over the years to the point that you don't even notice it anymore? I'm Nathan Anderson, Vice President of Product for Sterling in our Healthcare and Life Sciences division. And today I'd like to talk about what I've learned through numerous conversations with clients over the years and some of the solutions we're bringing to market to address that. In these conversations with clients, I've seen a few themes emerge. First off, just how much kind of effort and manual process goes into managing, collecting and monitoring licenses and the renewal process around it, and just how many kind of people are involved in the process. And the second is how little proactive ability there is to actually identify changes in licenses and be informed of that outside of self-disclosure or other limited approaches. And then, in addition to diving into these challenges a little deeper, I want to introduce you to our new medical license monitoring solution, which uses technology to automate this process so that it alleviates this administrative burden and also can help you proactively identify this risk by immediately sending you notifications should there be a change in license status so that you don't end up going weeks or even months without being identifying a potential issue. All right, so let's go ahead and dive in. The first challenge that I talked about is this kind of administrative overhead that comes with the process. And I think about this in kind of three different components. The first is just collecting, storing, and managing the actual license information. So this is the ability to get it and put it in your HRS, for example. And then the second step is tracking that information so that you can send reminder notifications and know when something is actually renewed. Usually this is done manually through maybe monthly reports or a similar service that you're just kind of tracking periodically. And the third piece is usually the most labor intensive is the actual verification process, especially if you're doing this in-house where you might be having to go license by license to confirm it's been renewed or for a new license to verify its initial status, capture that screenshot of the primary source and store that in the employee record. That can become very labor intensive if you're going to, if you have hundreds or thousands of different license types. The other piece of this is the risk mitigation piece of it, and that's the second big challenge that I hear with clients. This is really not something that most clients are doing because of the scale and complexity of the challenge. The reality is there's over 70 licensing boards, and you typically have hundreds of thousands of licenses, and you can't go monthly or weekly, let alone daily, and check that the status hasn't changed with that particular license. So most clients are relying on self-disclosure, or individual supervisors identifying this or looking for sanctions and exclusion sources to push this information. But the challenge there is that they tend to be delayed and not particularly reliable. And so this is where our new solution comes in, and I'm excited to announce today our medical license monitoring solution, which is part of our workforce monitoring platform. Our solution, as I mentioned, uses technology to simplify this overall process. Here's how it works. First, you will send the full employee file with the license information to Sterling. We'll take that file and we'll sync it with all your existing records, and we'll automatically add, remove, update records as needed. And then for every new license that we find, we'll verify that license, and if verified, then we'll enroll it in ongoing daily monitoring. And so at this point, we'll be checking daily for any status changes to that particular license. And if any are found, such as it moves from active to suspended or revoked, then we'll immediately verify that license at the primary source to confirm it is actually a match. And then we will send an email notification to the designated recipient so that you can investigate right away. In addition to the alert email notification, you can also optionally turn on expiration reminder notifications to the individual licensees as well, so that they can be reminded of approaching expirations and promptly renew ahead of time. Ultimately, the goal of the solution is to solve those challenges I discussed earlier, to make this a more efficient, streamlined, automated process, and also to proactively identify any issues to protect your company and your patients so these things aren't slipping through the cracks. Hopefully this has been informative, and if you'd like to learn more or see how this could fit in at your organization, please don't hesitate to reach out. You can find some more information on our website at sterlingcheck.com/healthcare, or you can reach out to your client success partner or email us at sterlinghealthcare@sterlingcheck.com. Thanks for watching.